Just trying to find you. I've been like a man.
And a very good morning to our viewers today of Pathology today. How are you? Good? Good. Today we will be talking about Parkinson's disease. Along with our special guest, please come and take a seat over here.
Thank you for having me today, Dr. Zuniga.
Thanks to you too for being here today. Our special guest today is a representative for many of the people experiencing and having troubles with Parkinson's. How are you, Ma'am Francine?
I'm good. Thank you for asking.
Is that right? Well then, I hope you don't mind, but I'll be starting up the question for our viewers today. This is an interview after all. You have your notes with you, right?
Definitely.
First of all, to get us starting, what is Parkinson's disease?
Essentially, Parkinson's is a neurodegenerative disease that affects neurons in a specific part of the brain, commonly associated with slow movements and balance problems.
Thank you for clearing that up. Then, what's the most common causes of Parkinson's?
The meat of the problem with Parkinson's is the loss of dopaminergic neurons on the substantia nigra of the brain. While not directly a cause for Parkinson's, age is a factor, usually 60 years and above.
Interesting. That said, can young people contract Parkinson's?
Yes, there has been a case of an 18-year-old having Parkinson's disease.
So this brain disease isn't strictly for older people equal and above 60 years old?
Yes.
If that is the case, then I'm sure some of my viewers are interested in learning the signs and symptoms of this disease. Care to elaborate?
Well, according to our sources, there are 10 signs that you might have this disease. These are tremors in the hand, having small handwriting, a loss of smell, insomnia, slowing of movements, constipation, a soft voice, masked face, fainting, and hunching over. Again, these are only signs. You may experience but not have Parkinson's.
That is a long list, isn't it? And I'm sure some of the audience are relieved after hearing that tidbit in the end. What about the symptoms of the disease then?
There are two groups of symptoms. These are motor-related symptoms and non-motor-related symptoms. As you can imagine, the former having difficulty with their motor functions, such as walking or holding something. The non-motor related symptoms are symptoms not related to movement. This could be having insomnia or having a loss of smell. Some people experience Parkinson's differently from others. This is why there is a rift of confusion for people that suspect they have Parkinson's, as they are so vastly different from each other. This could be because of Parkinson's being a progressive disease that increases in morbidity over time, leading to different experiences.
That sounds horrible, doesn't it? Scary. Even not being able to quick discern whether you have the problem or not. What about the doctors then? Do they have the ability to accurately diagnose whether one has Parkinson's?
That is a tricky question. Parkinson's does not have a one-way ticket to Parkinson's diagnosis because of the difference of experiences and severity. But doctors can accurately diagnose it through a combination of signs and symptoms and tests used for diagnosis. While it is hard, an experienced doctor can discern Parkinson's from your normal feverish mood. Still, it is very important that two symptoms should be present over a long period of time before a doctor can deem it to be Parkinson's. Either it to be a combination of tremors, bradykinesia, rigidity of limbs, or trouble with balance. If suspected though, it is better if the person themselves reserve an appointment to their nearest doctor and have it checked.
That's very severe for a disease. Going through loops and hoops just to realize whether you have it or not must be a painstaking effort for both parties. However, is there a light at the end of the tunnel? A cure for Parkinson's for people that have learned of this affliction on themselves?
No, there is no cure, even despite the numerous medical advancement in recent years. While there is no cure, there are sets of treatments for the afflicted that vary from one person to another, depending on their individual symptoms. Some treatments include medications and therapy, while others include much more mundane applications such as long resting time or frequent exercise.
It's a shame that there's no cure for disease. At least there is some solace of learning that there are treatments for it. In that sets of treatments we've talked about, which do you think is the most challenging for the afflicted?
Definitely medications. There's a wide variety of medications that one experiencing Parkinson's has to take, often having different meds in the morning and afternoon, all with varying dosages and uses. Still, management of medications has proven effective at quelling the effects of Parkinson's, if only for a small amount of time.
At least, it, it's good to know that one doesn't need to suffer with the treatments you've mentioned. Is there anything else you'd like to add, Mama Francine?
Not that I know of. We've already tackled the most important aspects of Parkinson's from what I'm aware of.
And there you have it, folks. While Parkinson's is typically found in older people, younger people as young as 18 are also risk for it. While it troubles some, there are ways to combat its effects. I hope my audience had a wonderful time today. This is Carson Niga signing out.
And a very good morning to our viewers today and Pathology tomorrow. How are you? Good? Good? Today we are all talking about sickle cell anemia. Along with our very special guest, please do come and sit here.
Thank you for having me today, Dr. Joshua.
Thank you too for being here today. Our special guest today is a speaker of the representative of those with experiencing of those troubles with sickle cell anemia. How are you, ma'am?
I wouldn't be here if I felt bad.
That is true. Well then, since this is an interview, I hope you don't mind if we get started with the question. I'm sure my viewers are waiting to come in a bit, and you have notes with you.
Yes.
Then let's start with the most basic question on the list. What is sickle cell anemia?
In essence, sickle cell anemia is an inherited form of anemia, a condition where there are too few normally functioning red blood cells to adequately carry oxygen to and from the body. Normally, our red blood cells are flexible and round, but in sickle cell anemia, the red blood cells are shaped similarly to half moons and far more sticky and rigid than normal. This makes it prone to clogging the blood flow on your body, and in turn, halts the distribution of oxygen in the body. It isn't as serious as it sounds, but if left untreated could cause quite a bit of damage to the human body.
It does sounds to be a particular messy disease. And so I'm sure of all us wondering, what are the common signs and symptoms of this disease? I know that we might actually have it.
There are quite a few, but the most important ones are episodes of pain, painful swellings of the hand or feet, frequent infections, delayed growth, and vision problems. Though, as are all signs and symptoms, they vary from person to person. Varying degrees of severity, frequency, and depth the symptoms change over time. In conclusion, even if you are experiencing any or two of the signs and symptoms, it is hardly a clinical indication that you do have sickle cell anemia.
That's a relief, because if I'm not mistaken, I'm currently having problems with one of those, but now we should talk about that is contracted. What are the leading causes of the sickle cell anemia?
As I've said earlier, sickle cell anemia is an inherited form of anemia. In other words, the only way one could contract the disease is through one's genetic. Specifically, this is caused by a mutation in the gene that controls the production of hemoglobin in the red blood cells. The genetic mutation alters the hemoglobin production and creates abnormal hemoglobin that appears in the red blood cells, causing it to be rigid and sticky and have an abnormal shape. To pass on this recessive gene is through the process of autosomal recessive inheritance, which requires that both parents must have the sickle cell trait in their genes to produce offspring that will also suffer sickle cell anemia. That said, if only one parent passes on the sickle cell trait, their offspring will be carried of the sickle cell trait, while they not have signs or symptoms or suffer sickle cell anemia. They still have it in their genes, which would be inherited by their offspring, and so forth.
That sounds frightening. So if we don't have the sickle cell anemia, or if our children will have it, what are the complications that may arise from having this disease?
There are a number of them. Apart from signs and symptoms, you have strokes, ACS, pulmonary hypertension, organ damage, blindness, leg ulcers, and gallstones.
Quite a number. Then how do we propose we have to prevent it from passing it in our future?
Consultation with a professional, a doctor, a genetic counselor, or what you have. It's also favorable should you consult with your significant other about their chances of having the recessive trait or have it entering.
If you do have suspect that you're experiencing the disease, how does a doctor go giving an accurate diagnosis?
Through a blood test, hospital check for the strain of hemoglobin S, which is a defective form of hemoglobin that underlies sickle cell anemia. If the test is negative, then we don't have sickle cell anemia. If the test is positive, however, then the hospital and doctors will have a routine blood checkup, further tests to check if the person has 1 or 2 sickle cell genes present. An additional test is to check the RBC count through a blood test and more tests for complications that may arise from it. All in all, it takes a considerable amount of time to be sure that someone has sickle cell anemia.
Should you have sickle cell anemia, is there some form of treatment of cure for it?
There are numerous treatments available for the sickle cell anemia, but the only true cure for it is a rather deadly and not too practical. The cure is a bone marrow transplant, or also known as a stem cell transplant. As I said, it's not too practical as there is a high risk of death, and that only people aged 16 and below can be given the transplant. Anyone older than 16 has a higher chance of failure. Furthermore, finding a donor for it is difficult. Treatments, however, are mild, which include medication as always. To relieve the pain and the symptoms and prevent complications from occurring, and blood transfusions, there are also experimental treatments, such as gene therapy, nitric oxide, and boosted hemoglobin production.
Interesting. At least we know that one doesn't need to suffer much when they have a sickle cell anemia. Do you have anything more to add?
According to my notes, no.
So, well, there we have it. Sickle cell anemia is inherited, and though there might be ways to prevent it, there is no surefire way of prevention. You should probably get your blood checked at the nearest hospital next time you go there. I hope you have a wonderful time today. This is your host, Joshua, signing out.